Good morning, everyone. Thank you very much for joining this webinar today, hosted by Vivid Care. Very much appreciate you taking time out of your busy schedules, wherever you are in the world, to come and join us today to discuss how to measure for specialist seating. And really, I think the key point here is that we're wanting to help give confidence and maybe some pointers and some refreshers on how to measure for specialist seating. And this is a topic that I feel quite passionately about because seat sizing can have a massive impact on someone's comfort, someone's posture, someone's press relief, along with all sorts of other aspects as well. So we'll be joining Joe McConnell, who a number of you who have joined our webinars before will have met. So we're looking forward to that. And for those that haven't joined us before, just quickly cover off a little bit about us at Vivid Care and what we do. So we're a family business set up in 1972, so a few years ago now, and we've been carrying out specialist seating assessments for decades now. It says 30 years on the slide there. I think it's a bit longer than that now. And we're very much championing British manufacturing. So all our chairs are made in Britain, which we're very proud of. And we work with a lot of healthcare professionals right across the world, particularly in the UK, where we've got 19,000 that we work with. So a lot of them OTs, a lot of physios, a lot of other healthcare professionals as well. And our chairs are out in the community and in homes all over the world, but they're also in 80% of NHS hospital trusts. So we do a lot in hospitals as well as in the community. And we're part of Core Care Group. So it's a family run group, as I said, and InnovaCare Concepts do fitted equipment. So things like hydrotherapy pool, specialist baths, specialist kitchens, that kind of thing, and Aquadapt do ramp systems and wet rooms, bathrooms, and stair lifts, anything to help someone stay in their own home. But we remain very much a family-run business. And on the Vivid Care side, our key core product range is specialist seating. So that's why we often do webinars on various aspects of seating. And this is our flagship range, the Lento range, which I'll be showing some of the products later on in the live demonstration. But in the 5 main products there, we've got massive flexibility and adjustments and different features to suit different people. So we love to see a complex specialist seating case because we know we can resolve it, and with having that UK manufacturing as well, we can very much create custom accessories or whatever is required to get someone sitting comfortably. And just using that word comfortably, well, I say this every time on these webinars, but our core, if you wanted to kind of if you wanted to ask me what our key focus is at Vivid Care, the number one word I'd use is comfort. And I think this is something that we won't stop talking about because we think it's really important, and we don't think that enough of us in the industry talk about comfort. And comfort's really important because if we're not going for comfort, if we're not trying to get someone comfortable in a chair, then what we're here for, you know, at the end of the day, we're about improving quality of life. And as therapists, as healthcare professionals, as advisors, whoever you are, you know, we should be focused on patient comfort. And patient comfort means that someone is able to get out of bed and into a chair and enjoy the surroundings more. It's enabling someone to sit out for longer It's enabling someone to be out of a hospital bed into a chair to reduce deconditioning, to speed up rehabilitation, to help people get their life back. So comfort is absolutely key. And as I said before, a key part of comfort is getting the seat sizing correct. I'd go as far as saying sort of about 80% of getting a chair comfortable is getting seat sizing correct, because that feeds into posture, getting the posture correct. It feeds into making sure that we've got the adequate support, which means in turn that we're spreading pressure across the body correctly to reduce the risk of pressure tissue damage. So seat sizing, absolutely critical. And we're looking forward to what Joe's going to be talking through today. And the way this webinar will run is that we'll hand over to Joe now, who's got a presentation to go through, and then I'll go downstairs and go through some practical considerations and show you some of the adjustments on some of the chairs, to just kind of spark that interest and thought process into, you know, how can you best adjust your chair to suit that individual in terms of seat sizing. And then we'll be back up here and doing a live Q&A section. So as you're going through the webinar, please do put questions on the chat, and we'll answer those at the end of the session. Contact details on there if you want to look up more about us during the webinar or afterwards. Please do take a note if you do want to arrange a one-on-one kind of session in terms of assessment, or you want to do a team demonstration or a trial in your healthcare setting. Please do reach out. We love to meet different people, and we're all over the country throughout the week, so please do give us a shout. So without any further ado, I'll pass you on to Jo McConnell, who's an OT and clinical team leader for a wheelchair service. So she deals with a lot of postural situations every week and has done for a very long time. She's got over 33 years experience now across multiple sectors. So Jo, over to you. And thank you very, very much again for joining us today.
Thank you. Thank you, Tristan. So, welcome. As Tristan said, appreciate everybody's time, and CPD is so important for us as clinicians, and just taking a bit of time out for yourself to reflect on what sounds like a basic, maybe a dry topic, the importance of taking correct measurements for improving clinical outcomes. Really, that needs to be everybody's starting point before we think about any of the next stages. So that's what I'm going to go through today, looking at the objectives for carrying out the most effective clinical measurements and what can happen when the measurements aren't taken or aren't correct. So here are the learning objectives, which I'll go through during the webinar in a series of slides. So I'll make a start. I don't need to read through the objectives for you. So thank you again. Okay. So the headline boxes here are what are the essential measurements when carrying out a seating assessment, whether that is for comfort home chair, specialist comfort home chair, like Tristan was discussing, whether it's for a wheelchair, which is a large part of my work, whether it's for more active seating for function at home, for a child, young person, young adult, or an adult in the home environment where they're working, whether they're at college. So all of those options need to be considered, but we also need to ask what is the type of seating. That will change sometimes the importance of some of the measurements. I will go through that throughout the presentation, but I would say that definitely, and this is very obvious to some people, but important to stress again. Seat width and seat depth is what I would say are the two crucial measurements, and without those, you don't have a starting point. But also very important is the lower leg length, which will also determine the seat height, and that seat height will be important for different types of seating, which I'll come on to. The back height, what back height is required, the arm support height, armrest, arm support, and at the bottom there I've added seat height because that can be considered as a standalone measurement, but it also links back into lower leg length. Okay, so these are the essential measurements that we need, and that sometimes we think we're good at taking, and other times if we reflect back on how did I take those measurements, why don't they look that great now I read them on paper, where now I need to read them in my clinical notes, do they actually even make sense? So let's make sure we're best equipped for taking those best measurements. Okay, so what equipment, resources are needed when we carry out? So this is a starting point. Sometimes it's good, I find, to remind ourselves of this. And, you know, if you have a new team member starting with you, or a student with you, maybe, or you've just got somebody visiting your team for the day. And I always think the things that we take for granted when we are more experienced are the things that somebody else would think, oh, I hadn't thought of all of those. That's why I thought in the introduction I would add this slide, and just hopefully we all agree that these are not difficult items to gather. That's things that we should all be able to access, and just remind ourselves of what they are. So when I say a firm tape measure, I mean a tape measure like this. So for measuring accurately for seating, just think a little while in your own head quietly, why wouldn't a soft tape measure be as accurate? And I see it all the time, especially less experienced team members, and sometimes when I'm reading a referral form on triage, I will read a measurement and think, blimey, that is a very large measurement there that's been given in for somebody's seat width. So seat width we mean by hip to hip measurement most of the time. So I will sometimes read that somebody's 12 stone, just give you an example, 12 stone, so we'll ask on many assessment forms when we're gathering the essential key data at the start, we'll ask for height and weight, and then we'll ask for some seat measurements, and I'll read something like 12 stone, seat width 22 inches. So it's fine to measure in inches or centimetres, and depending on people's age, really depends on which method of measuring they use. 22 inches, and I'll think, do they mean 22 centimetres? No, they can't do. And then seat depth, they'll say something like 17 or 16 inches. So I'll think somebody of 12 stone is not going to really have a measurement of 22 inches. And what will have happened? They will have used a soft, and I don't even have a soft tape measure with me, a soft tape measure, like a dressmaker's tape measure, I would call it. And then they've measured around the person. So it will curve, and it will be larger than if we're measuring from point to point. So I'll say to people when I'm doing training face to face, I'll say, we're not measuring for a pair of trousers or a suit. We're measuring anatomical points on the body. So it's from widest point of one side of the outside of hip to the other. But often people will have measured around, and that's why they would have got that strange measurement. So a firm tape measure is essential, not a dressmaker's one. But if you only have a dressmaker's one, that is better than no measurements. A firm seated support surface. So again, if we're going to measure somebody on a floppy mattress on the bed, on an air mattress often, type of clients we're working with, or on a floppy sofa at home, that is going to compromise what measurements we actually get. The next point, a colleague, if available, or even if a colleague isn't available, somebody else, like a carer, another person in the room, just at least for them to sometimes support a leg. Could you just put your hand on their leg there? Could you just hold their leg while I take this seat depth measurement? Or could you just write these measurements down for me? You know, have a pen and paper. Could you just write these measurements down? Consent to proceed is important. So saying to the individual, I'm here today, this is the starting point of the assessment for your new seating. Are you okay? Is that okay with you if I take some measurements, which will mean me putting my hands on points in your body to get the accurate measurement? Are you okay with that? Consent to proceed is always important. Pen and paper or a tablet, whatever you're using, and enough time. Do not think you can pop out and measure somebody in 5 minutes while your colleague's waiting in the car with the hazard lights on. That won't give you good measurements. So there's the equipment and resources that are needed at the start. Okay. Moving on. This useful document, I've added it here for just a piece of information and discussion point, is really lovely resource that's available from Vivid Care. They have a wealth of resources on the website that many therapists or healthcare professionals or care workers would find really useful. And it's a checklist, which I had a really nice look through and thought, I'm just going to mention this because it's got a lot of really important background information in it, things that we might not think are important. Although it's not just relating to measurement, I just thought it was worth highlighting it as a great resource that's there on their website to just guide you through some of the things that you may not have thought of. So measurements will also relate to linking with the home environment. So especially this is relevant if you're looking at door widths, etc. So I'm going for this chair for this bariatric client. Will it go through their doors? So while I'm thinking of measuring the client, I'm also thinking in my OT toolbox of the home environment and the impact the equipment choices have on that, or the limitations the home environment give to your equipment choices. So there's all sorts of useful information. And I just thought this form, I would highlight it because I found it useful when I was looking at some raw resources on the website myself. Okay, next. So coming on to the starting really with the first objective is the background and why we need to take accurate seat measurements. So the critical importance of seat sizing and how this will impact on our clinical outcomes. So as I said, majority of the reasons that seating will fail, apart from people's needs having significantly changed, it will be that right at the starting point, accurate measurements were not taken. So the most important measurements and the essential measurements are always the seat depth, the seat width, and the seat height. So, or otherwise lower leg measurements. So some people will call it seat height and some people will call it lower leg measurement. Of course, if we've got a very tall person, thinking somebody over six foot, which is not unusual to see. They like giants to me because I'm 5'1". You can see it's not unusual to see a lower leg measurement of 20, 21 inches sometimes. So then that will, depending on the type of seating, that may limit your choice because if it's on a wheelchair, for example, you need to have ground clearance when that chair's used outside. So the lower leg measurement versus the prescription form options may mean, I'm in a bit of a tricky situation here. So already you're starting to use your clinical reasoning toolbox and you're thinking, I can't get any higher than that in that particular seat for that particular function. So I'm going to have to artificially create the seat height I need by using a higher cushion. So that will give you more lower leg option. So that's just an important point to remember as well. But seat depth and seat width are absolutely crucial. And many of the reasons why seating comes back, or you'll get a call, need this person's seating reviewed, it's awful, they're sitting terribly in it, this is too long, this is too high, this is too wide, this is not wide enough, it's because the measurements haven't been correctly taken at the start. So let's always start on the best possible possibility for that person and for your own clinical times to have those measurements really solidly taken. Okay. Next. So again, without accurate measurements, things will start to go wrong and things, the individual, most important in all of this is that the end user, the client, the patient, whatever your terminology is, their confidence in the seating, their experience of the seating and their tolerance of the seating will be affected if they're not in the correct seat size. So let's look at why mistakes are made when measuring seat depth. That's a common one. And the illustration side on there gives a lovely simplistic view of what could go wrong. So if you look at the image of the gentleman sat on the seat, you can see that the pelvis is upright and neutral. I have my pelvis here. So the pelvis is upright and neutral. So they're loading on their sitting bones. So that means you've got the best base for measuring. If it was rolled back, we would be measuring a longer seat depth than actually needed. So you can see there that the pelvis is upright and neutral and they're loading on their ITs and the tailbone, the coccyx is here. So that means there's no gap behind their bottom because their bottom's right back against their back is back against the back support and their bottom is back as far as it will go. Then the femur length, the thigh length, you can see the thigh is nice and level. So you can take a seat depth measurement from behind the furthest point behind the bottom, right up until the popliteal crease, we would say, but it's the gap behind the knee when the knee is flexed. And there should just be, like you can see in this picture, a little gap there. And we sometimes say a 2-finger gap behind the back of the lower leg, behind the knee and the seat cushion. So that is your seat depth. So there you would take a measurement using a firm tape measure and you would measure along. Okay, so that is the correct seat depth measurement. So to understand that better, and you can see the feet are on the floor, so that's a really lovely height as well. So let's look at the next slide and just talk a little bit more about the pelvis, which I have my friend the pelvis always with me, because not all of us are as confident with the pelvis and understand how it impacts on our seat depth and seat width and many things within postural seated posture. So looking at the front here, where you can see it labelled, and I'm touching on the pelvis here, that is the ASIS, the anterior superior iliac spine. So that point at the front is our key reference many times throughout a seating assessment for looking at how the pelvis is placed. And then PSIS is directly behind it here. And it's the bony prominence. You can feel it's on that picture. It looks like it's higher up, but it's actually, if I put it side on, they're actually level when the pelvis is neutral and upright. So the PSIS is the posterior superior iliac spine. So those points are what you will hear referred to a lot in a seating assessment report. The ASIS were manipulated and were level. The PSIS were level or were not level, there was asymmetry. And then the bones at the bottom here, and you can see it on the diagram on the screen, the ITs, the ischial tuberosity, the sitting bones. So they are the 3 main things we'll hear referred to in seating assessments, and these are what affects. So just a quick quick one again. When pelvis is upright and neutral, we'll be loading on the ITs. When it's posteriorly tilted, rolling back, we won't be loading there. It will give us a longer seat depth than that truly is, because you'll be measuring from here, so you'll have this gap behind, and you will not be loading on the ITs. You'll often be loading on the coccyx or sacrum, which can create pressure issues and make people vulnerable to pressure injuries. So I just wanted to recap on the pelvis again, because we cannot learn enough about it. Again, there's many useful documents on the website, on Vivid Care's website, relating to seating assessments. Okay, next slide. So what I was talking about, here's the same guy again on the seat, but he's sitting differently now, isn't he? So this is because his pelvis has rolled from upright into posterior tilt. It's a common seated position that we see in many people, and very often in the elderly. So you can see then behind his bottom, there is, like, I'm just guessing here, a 2 to 3 inch gap, sometimes more. So if you're to put your hand in behind somebody when they're seated, you'll think, blimey, I can get my whole, and it'll often be, I'll say to them, I can get my whole fist behind your bottom and the seat back. And I'll show them, I'll say, that's how much of a gap we have behind you. Can you see if you can get your pelvic, can you push your bottom back? Can we assist you to push your bottom back and see if that's possible? So the pelvis roll backwards, so the person slides forwards, which will often then mean that we're taking a seat depth measurement that isn't accurate. So we're measuring from the back of the seat to behind the knee, popliteal crease. And this is where sometimes people will say, oh, they've got a seat depth of 22 inches. I'll go, blimey, how tall are they? 5'6". Right, they will not have a seat depth of that. Have you checked their lower leg measurements? So this is a tip that I've written there in italics. Tip, seat depth, so thigh length, femur length, thigh length, should closely match the lower leg measurement in majority of cases in typical clinical presentation, unless there's a reason for that achondroplasia, etc. So if you look at your paper measurements, as I said, one of the essential things, write it down and think, I've got 21 and then I've got a 16.5 lower leg. Right, I need to check again. So it will be that you've measured with somebody within posterior tilt, which looks like they've got this huge seat depth and they haven't. That will also be one of the reasons people will say, could you come and review their seating at home, please? Could you review their wheelchair in the clinic? Could you come and check again if they're in the right seat? What's the issue they're having? Oh, their seat depth. Well, they've outgrown it. It's got this massive gap behind their knee. Right, how old are they? 40. They won't have outgrown it. They will not have grown any taller. They may have grown wider, but they will not have grown any taller. So it will always be, I'll smile when I read it, they're not back in the seat correctly and their pelvis is posteriorly tilted. I've just put some other little notes there for reference, what other effects posterior pelvic tilt will have on seated posture. Okay, so that's a really common thing that I'm sure you've seen yourself. So just double check your measurements. If it's lower legs 16 to 17, a seat depth should be about 17, but you'll just a really good simple checking point for you. Okay, next. So another one that I'm going to mention to do with measuring seat depth is that sometimes people say, oh, they've got a massive leg length discrepancy. Right, okay, I'll see when I get out there, but thank you for making me aware of that. Yeah, they've got like 19 on the one side on the right. On this one, looking at this person here, they've got 19 on the left and 17 on the right, somebody might say. And I'll go, right, so my first thing, oh, have they got a dislocated hip? is that's what's causing the leg length difference. Is there a congenital reason why? Have they had a complicated fracture early in life? Have they got an actual leg length difference? But what it usually is that the pelvis is rotated. So the pelvis will not be level, it will be rotated, which will make one leg seem longer than the other. So to check if the pelvis is rotated, obviously we're checking from behind. So the easiest way to do that is to stand above and look down. And if their pelvis isn't touching the back on both sides, it will mean their pelvis is rotated. You can put your hands on the pelvis, on the ASIS, and feel from the front. And if one finger looks forward to the other, it will be this pelvic rotation. The only way to really check that is to look at them in lying on their back, in supine lying, and see then you can do an accurate measurement of is there a leg length difference. So that's just important, another thing to think about with seat depth. Okay, moving on. So let's talk about the next objective, which is seat width. So again, this is a common thing. People will go out privately and buy their own little chair that they think is going to work for them at home, or their own cheap little wheelchair that they got from a charity shop, or they've bought online from Amazon that hasn't been assessed for by anybody, and the best will in the world. They think they're doing the right thing for their family member, but they've bought a chair that's often way too wide. So let's remind ourselves of the implications of seat width that is too wide. How will that affect the trunk and the spine? Well, it encourages, because there's a lot of space there, encourages leaning posture. If somebody's not as strong in their core, they have weakness in their trunk, they may have paralysis on one side of their body. If they're not in the correct back width with the correct lateral support or lateral prompt, contoured back, they will take up that space and lean to their weak side. Then you'll see the person shoving all pillows and blankets and rolled up towels down the side. This is something we all see all the time, I'm sure. So if it's too wide, the client tends to lean to one side or the other because they don't have enough support. And this can be especially problematic for clients who already have poor trunk control because of their condition. They have changing postural control through the day, so they may be stronger in the morning, weaker in the afternoon. So in the morning they might manage with the wide back, but in the afternoon they'll be like this, which is putting a risk on their spine, and there may already be spinal asymmetry or pelvis asymmetry that then is just going to deteriorate further through the day. Okay, next slide. So looking at it in a skeletal view, so the leaning posture will be compromised when the sides of the trunk isn't supported sufficiently. So they will have difficulty throughout the day maintaining a nice upright midline position, which is where we always want them to be. And then we'll see, do they always lean to the same side, or could it be that they'd lean either? So if it's just trunk weakness, they could lean either. But if there's some postural asymmetry like scoliosis, they will usually lean to the same side. So the correct seat width, an important measurement that you can be responsible for at the beginning of the assessment, when the very first starting point is, have I selected the correct seat width and back width? So if also, just to say at this point, if the seat width was too narrow, we could be causing skin integrity concerns because there could be too much pressure on the side of the legs or on the side of the trunk. So trying to squeeze somebody into a seat that's too small is also very detrimental and could cause pressure, injuries, and of course, compromise comfort and sitting tolerance. Okay, next slide. So that was more talking about the back width and the trunk, but if the seat width, so thinking of our lower half of the body, our pelvis, hips and legs. What will happen if the seat width is too wide for the lower part of the body? Okay. So we can often see if there is too much space, the legs will take up that space. So whereas if we're in a correct measured seat width, we can nicely align the femurs in neutral alignment and make sure that they're supported with thigh guides or with padding at the side, with the arm width, correct arm height width correctly adjusted, to keep the legs nicely aligned. If there's too much space, one of the things that can occur is that we can see external rotation and the legs spread wide into abduction. So we want the legs aligned here. If there's too much space, one of the outcomes can be that. Also, if there's too much space for the pelvis, it'll encourage the pelvis to become oblique. So one side of the pelvis higher than the other, because we could lean to into the wider side. So that the pelvis needs a stable, correct seat width to hold it nicely, securely in place. Okay. So when we're taking measurements, we need to make sure that we're measuring what is achievable. So on somebody whose legs are wind sweeping or abducting, we need to still be mindful of the hip width measurement for our seat width. But if the legs are actually stuck wide like this in abduction, or wind sweeping to the side, which I'll talk about in a second, where are we going to measure for that seat width? So we need to understand, are the legs fixed or stuck in that position, or can we bring them back into neutral alignment? So because we need to know where we're measuring from, because the hip width could be significantly narrower than where the legs are falling. And that's why we need to make detailed, accurate measurements and some notes. So with wind sweeping, this is an interesting one, and one that people get confused with hip pelvic rotation. They're very different things. So with wind sweeping, both of the legs sweep, fall to the same side. It'll commonly be seen with when there's been a painful hip, when there's a dislocated subluxed hip, and there's always mostly tonal involvement with that. So the tone will pull the person into asymmetry. It could be habitual from years and years and years. So it will give it will often create discomfort and reduce sitting tolerance. But why it differs from pelvic rotation, with pelvic rotation, I said if you looked from up above, you would see that one side of the pelvis is forward to the other. So there'd be a gap down behind one side because it's rotated. With wind sweeping, and not many people truly understand this, with wind sweeping, the pelvis remains level, so you wouldn't see the gap on side, but the hips themselves sweep over. So when you're recording, is it wind sweeping or pelvic rotation I'm looking at here? You need to stand up above, look from behind and look down and see if the pelvis is level at the back, but the legs are sweeping, that's wind sweeping. If there's a gap behind one side of the pelvis, it's pelvic rotation. Sorry, it's another soapbox moment, but correct seat width helps the legs remain and be supported in a more neutral position, neutral alignment. If we've got all that excess seat width, it allows space for this sweeping or for this abduction. So we don't want seat width so wide that the legs and the pelvis and hips can choose, I can go wherever I want to go because that's what I'm going to do. No, we need to give the correct clinical positioning options and the correct seat width to make sure we can maintain that person in neutral. Okay, next slide. So we want to support the upper legs, the thighs or the femurs, in as neutral alignment as possible. So the position of the femurs, thighs are obviously fundamental component of successful seating outcomes. So this will be compromised if we're not putting the individual in the correct seat height. So many a times, I'm sure you've seen it yourself. I saw somebody just earlier this week. They came in to see me in clinic. It was a guy who was over 6 foot tall, and his legs, his knees were, you won't be able to see my legs, so there's no point me showing you, but his knees were going up uphill, like going up a ski slope. And he wasn't uncomfortable. He wasn't comfortable, and he couldn't sit in the seat for home for long. He was choosing to spend a lot of his time in bed. This was in a wheelchair seat, but I imagine his home seating may also have the same issue. And that's purely because the foot plates, the foot support was not at the correct height. So his knees were being forced into a much higher position than his hips, which was giving him a lot of hip pain. And there was no support under his thighs at all. There was just a huge gap. Could get my whole arm under his thighs, and that's because the seat height was wrong and the foot support height was wrong. So the goal should be to support the thighs horizontal, flat as possible, so that there's comfortable and even pressure for the soft tissues under the thighs. So you shouldn't be able to get really anything under the thighs if the loading is correct. So that simple diagram there shows that the feet are on the floor or on a foot support and that the thighs are level. Okay, next slide. So this is looking at the objective for of the correct seat height, which will very much depend on accurate measuring of lower legs. So accurate measurements and setup is essential because the lower legs and feet need to be supported. Otherwise, the pelvis and spine will be compromised. So with this gentleman I'm talking about with his knees up in the air, he was loading so heavily on his sitting bones and he was in discomfort and a risk of pressure. So the goal is to align and fully support the lower legs and feet to encourage equal weight distribution whenever possible. This isn't always possible with some of the clinical presentations. So we also need to consider what else is going on in the legs. So there may be limitations in their range of movement in their knees. So we may have to look at an elevating leg position or often a very adaptable foot support option where we can slide the foot support out slightly. If they can't tolerate 90 degrees, we could go for 80 or 70 degrees. And just really look carefully what's going on in the lower legs and why are they uncomfortable? Why are they not tolerating sitting for long? Is it just that it's too much? They have edema, they have potentially leg ulcers. All of this was important information about their lower legs and feet. So some individuals will definitely need more complex options for foot and lower leg positioning than others. Okay, next slide. So seat height, this is the type of tape measure I'm talking about here. Lovely OT measuring there. And so seat height, there's many decisions we need to make about seat height, and it always relates to lower leg length. So you can't make a decision about seat height without knowing somebody's lower leg length. This is really important for not just the successful outcomes of seating and comfort, but for their functional outcomes, their safety outcomes with transfers. So is this person able to perform a standing transfer if the seat has been prescribed at the correct height? Without the correct height, am I limiting that person from that assisted or independent standing transfer? So this is one of the reasons why the OT is taking measurements here. Are they using a stand aid? That also will mean that they need to be at the correct height. Where you will have a little bit more leeway on this regarding transfers and seat height is if somebody's been hoisted. So if somebody's been hoisted, they'll often maybe hoisted in with the chair tilted to get them back into a good position. We would say that the seat height for those individuals is less crucial because they're having a fully assisted full hoist transfer. But it doesn't mean that we don't need an accurate lower leg measurement to make sure that their feet and lower legs are supported. So not everybody will put their feet on the floor. Some people will need a specialist foot support. So depending on whether it's home seating, wheelchair seating, whether it's more functional college dining seating, school seating. So lower leg measurements is crucial. And always check, like I said, when you've got the person out of the chair again during the assessment. This could be in the assessment process. If you're not quite sure you've got all the information correctly, take some measurements of the seat afterwards. That's nothing wrong with that. I'm just going to double check what I've written down here in the assessment. I'm going to just take my proper tape measure like that. I'm going to measure, now the person's out of the chair, what those measurements are, and check it with the measurements I took. I find that a really good, useful activity to do. Okay, next slide. So just to remind us of the objectives so far for seating measurements, and what problems do we see if she have not, sorry, that's my poor typing there. If we have not taken accurate measurements, sometimes I get slide blindness with too much typing. So if we haven't taken correct, accurate measurements, what are some of the common problems we may see? And that's the floppy tape measure I'm talking about, by the way, in that picture. So I'm not a fan of them unless I'm going to make an outfit. Okay, next slide. So I thought I would just write down here some of our compromised outcomes if we're not taking time to take accurate measurements. So, and I've just used this one example here. Again, there's lots of interesting information on the Vivid Care website to help you with your clinical reasoning. So the client slides forwards in the chair, be it the adaptive home specialist care seating, or be it a wheelchair. This will be a common thing. Please, can you come and review this guy? The seating isn't working, sliding forward. So let's think of some of the reasons that could be. So we need to measure again. We need to go and see them. We need to talk through what the problems are. But usually the problem will become pretty obvious as soon as we see them. So measuring, is the seat depth adjusted correctly for the client? Because on the phone, the wife has said it doesn't fit him. There's no support under his leg at the front. He's sliding out. So he hasn't, that chair that you measured for, this isn't the right one that's come. So you'll go out and review and you think it is the right one that's come. Everything is correct. The guy is not seated back in the seat. That could be the one outcome, usually is. They're not using the pelvic belt that was supplied with it. So you're not helping to keep them correctly aligned with their pelvis in the seat. But it could be that the seat depth isn't long enough. So it could be that a chair's been found in stores, best will in the world. You thought it was going to be adjusted. It hasn't been adjusted. So they're sitting in a seating that is too short for them. So then they could well be sliding out of the seat. That's one thing. So let's think going down through the body, through the checklist. Pelvis, how is that person's pelvis aligned and supported? So remember what we talked about earlier on about how the pelvis is so important. Is their pelvis posteriorly tilted? Is it rolling forward? Is that force causing them to slide in the chair? Is it the correct seat width to keep their pelvis in a nice stable position? Is the correct contour in the cushion to help keep their pelvis in a nice upright position where they're loading on their sitting bones? Thinking of seat height. So is the seat height correct for the lower leg length for the transfer method? Is the seat height too high? So they're seeking stability from the floor, and actually that's causing them to slide forward. Or is the seat height too low, so their legs are up in the air? Are the foot plates too high, like the gentleman I talked about a few minutes ago? All of these things are in your little detective healthcare clinician toolbox. You have to be the detective as to why the client is sliding forwards in the chair. And all of these points are to do with accurate measurements. So support, are the feet at the correct height and angle? Are they supported? Is the seat width correct? is the back height correct? All of these points. And then you've checked everything. Has anybody actually been out and set up and adjusted the seating correctly and accurately? So has the fine-tuning aspect taken place? You could buy the best seating in the world. If it's not set up properly, if it's not measured for, if it's not fine-tuned, that person may well be sliding forwards in the seat. Okay, so I just thought that's useful to go through a little bit of a common scenario that we see and relate it back to the objectives so far. Okay, next. So armrest, arm support height in special seating, whether it's a lovely supportive care home chair like the one in the picture, or whether it's a wheelchair, or whether it's more of a working chair, the armrest height is crucial, and it's a crucial part of somebody's stability and function. So make sure we're measuring for armrest height. And a good reference point to measure for armrest height is from the middle of the seat depth, because there's no point measuring right from the back, because we don't hold our arms right back, do we? If you think of how you're sitting now and where your arms naturally want to sit, a good measuring point would be from the middle of the seat depth, or from the middle of your arm. So not right back really by the elbow, but in the middle. So record the armrest height and make a note of that in your clinical notes, because that could be one of the reasons why the person isn't sitting as well in the seating as they did in the assessment. Oh, they sat lovely when you came out that day and did the assessment. They're not now. So the arm supports may be too low, or they may be too high. So make a good reference point. Where are you taking that measurement from? So I would say always take it from the seat cushion up to where their arm naturally sits. The arm support height can easily be adjusted and fine-tuned with the majority of good appropriate seating. If it's a very fixed arm, and then it's not in the right height, that's where you need to query, are they in the right seating? So the client's arms should sit gently, comfortably. Here's this word again, with the shoulder in a nice neutral position. We don't want to see somebody sitting with their shoulder up here. That means their armrest's too high, because it's obvious, but sometimes it's like, oh, they can't sit in that chair for long. They're very uncomfortable in their neck, their shoulder, everything. Right, the armrest's way too high. Also, if the armrest is too low, it can encourage them to lean, because they haven't got the stability there. Often people will prop quite heavily on their forearms for stability. We don't want to take away any function. We want to make sure that people are confident and comfortable in their seating with using the armrests, arm supports as part of their postural setup. And then people have good proximal control when things are right in front of them on a table, on a tray, when they're propping on the armrest. But we also want them to feel stable for distal control. So they're leaning out of their base of support. And that's because the seat is fitting them well in seat width. The arm support height's correct, so they can use the other arm support to give them stability while they reach away from their body. That's called distal control. So arm supports are often overlooked, but we need to make sure they're comfortable, even pressure, the correct height, and the correct width. Okay. Next. And then back height. So appropriate back height does relate very closely to comfort and support for that client. Often back height in a more home seating will form part of the head support. So that's quite different in wheelchair seating. With wheelchair seating, unless it's a molded type specialist seat, you'll have a separate head support. So the back support will end and the head support will start. They're two separate things, but often in home seating, the back support will form part of the head support. So you need two measurements usually, and that's back height to shoulder and then back height to top of head. and then you'll make your clinical reasoning. What is their head support like, and how much head support do they need? And that will form part of your decision making. But measuring the correct back height will make that individual feel more secure. So if a back height is too low, unless it's for a very active sitting function, like somebody sitting maybe at a computer, or somebody sitting in a more active self-propelling wheelchair, then somebody would need a nice lower back for that specific function. But I think the type of clients we're thinking about today, they would need a higher back height to give them greater surface contact with the back and to help them feel secure and comfortable. So if you need to add a postural harness, this is often a hot potato subject in many fields of work, and especially in the field that I work a lot of my time in. So a harness, in my opinion, and in many clinicians' opinion, should only be used for postural control and not for restraint. Obviously, that would be a whole separate thing. So if a postural harness is being fitted, it needs to be fitted in line with the top of the shoulder. So there needs to be a means for the harness to come through. So if you were to fit a harness on a higher back, the pull of the harness would be coming right down. It would be injuring somebody's face, and it could be dangerous. So harness fitting, postural harness fitting, relates very much accurate. It relates very importantly to accurate back support height. And if a client needs tilt or recline within their seating, or both, you will need sufficient back height to support them when they are tilted. Okay, so that's a little bit about the importance of back height, and obviously that links so much in with the individual's postural requirements. Okay, so once we've got the correct seat sizing, so as I said again, seat width, deep seat depth, lower leg length, lower leg length, seat height, back height, arm support height, then we can start to really make that seating bespoke for that individual's needs. It may be that the seating we choose has all of those components already within the toolbox, that you can get the correct contouring and lateral supports and segmented back from that seat, or it may be that you need to add additional elements because their postural needs are so bespoke. So it may be that you need to swap out the cushion for a more posturally positioning element to help really keep their pelvis in a pelvic well, or it may be that you need to add air into the seat cushion. So they may need to have an air cell component within that because of their incredibly high skin integrity risk. It may be that you need to add a proper 4-point postural belt, which isn't a lap belt. And it may be that you need a very specialist head support adding because their head is so compromised, there's no head control, and to keep them safe, we need a very specific postural head support. So the ability to adapt the seating and create bespoke outcomes really should be steering you to what type of seating you go for. And the fact that companies are able to do that because they're UK manufacturers and because they have a whole wealth of specialist adaptations they've previously done, that should really make your decision making a lot clearer when you know how complex the client will be and how future-proof that seating needs to be to meet their clinical needs. Okay, next. So just a little statistic that I've used on another slide. If you've been to any of the other webinars, I think it's important to realise how much of the day we sit. And this is just from a global study. So the average person sits for 4.7 hours per day, according to a global review. So think of the clients that we work with, and we'll be the ones saying how long and it is for them to sit safely when they need to use tilt if there's skin integrity issues. But just think, if we're expecting somebody to sit in the same seat for up to 4 hours, we need to make sure we have taken those measurements accurately and that we have made the correct clinical recommendations to support their posture in that seat. Otherwise, it is going to be a seat that won't be used, and they will end up becoming people that spend majority of their day in bed, and often see people that haven't sat for so long that they've now lost all sitting tolerance, and they're cared for in bed, in a profiling bed. So I think that really does take away so much of that person's quality of life, and so much of that person's ability to have any independence, really. So let's make sure we do the best from the start with our seating recommendations and assessments. Okay. So I always have to do a few soapboxy things, like that's just my style, I'm afraid. So things we always need to remember: you don't have to have all the answers. You don't need to feel like you're a seating guru, or you've worked your whole life with seating and posture, which my majority have. But you just need to know that you can do the best for that person on that day by doing the simplest of things, which is taking time to understand what their needs are, and taking time to take good measurements, accurate measurements. So supporting quality of life and independence involves recommending correct specialist seating, whether it's home seating, wheelchair seating. And without the correct measurements, this will never be possible. So that's why this webinar is important, although it sounds like it's a bit of a boring, common sense, dry subject. There's a lot of people that don't understand all the details that I've been talking about today, and that's why Vivid Care asked me to do this webinar. Although it sounds basic, it's the main foundation of anything we do. So good posture begins with a stable pelvis and a comfortable seated position, helping the person feel balanced, secure and secure. Okay, next slide. And just some takeaway thoughts. And so when we talk about taking measurements as part of our clinical seating assessment, let's reflect on all that we've taken time today to think about. So the starting point for every posture assessment is the willingness from yourself and from people in the team you work with, from your colleagues, to take detailed measurements. And that has got to be the starting point and the most basic thing we can do to create the best outcome. So for all individuals, effective postural management plays a crucial role in their healthcare. So it isn't just seating, it's part of their healthcare. And that's why we have to keep fighting for the right seating for the users that we're working with, and not just take it. You've got to give them that seat that's in the store, actually, because it's there and it's available, and we're not buying another one. So fight for that individual, use your clinical reasoning, and go back and say, it doesn't work for these reasons. So utilising appropriate specialist seating can support the maintenance of optimal seated posture, safeguarding both physical health and emotional well-being. This is bread and butter about what OT is about to me, but it's also about many other areas of healthcare as well. And this approach can enhance overall quality of life and promote greater independence. So finally, I would say, if I had to say anything after today's subject, it's never acceptable to say, I didn't manage to take any proper measurements. And actually, I will have that conversation multiple times a week. Sorry, I didn't have time to take the measurements. I think they're about 18, or when I think they're about, that's not good. It's never good. So hopefully some of these points will help you take really, really robust clinical measurements next time you're involved with a seating assessment. Okay, and I think that's all of me done, so I can hand you back to the capable hands.
Thank you very much, Jo. Much appreciated.
You're welcome.
Some fantastic information there, and I can see we've got a few questions in the chat and on the Q&A section at the top as well. So please do keep adding them there, because we will be joining you again later on.
Have a read through those questions now while you're talking, so I can get my head ready to answer some if there's any. Okay, I'll turn my volume off. Okay.
Thank you. So for this next part of the webinar, I'm just going to go downstairs to our video assessment room, video demonstration room, and just show some examples of chairs and how you might think about adjusting them, measuring them, just to try and bring what Joe's been talking about to life a little bit more. So just bear with me a moment. I'm going to switch downstairs to the video room. Just a moment, thank you. Hello, hopefully you can see and hear me there. Could I just have a little thumbs up, Joe, if everything's all right? Good, thank you. So I've got just a couple of the chairs in the Lento range in the room here. You'll have seen that there's more in the Lento range from this slide at the beginning, but these are the two kind of most popular chairs because they are very adjustable and brilliant for all different kind of situations we come across when we're trying to get someone in a comfortable seated position. So the one on this side is what we call the Lento Care Chair. So this is obviously with the larger wheels and designed primarily for someone who's hoisted. So good support, good comfort, and a lot of adjustment. And then on the other side, we've got the Lento Mobile, which is a wheeled version of a rise recliner. So we've got the same adjustments, same flexibility, but we've got the rise action and the recline action, and we can also porter the patient in it, the user in it, and we can also use a stand aid or other transfer methods as well. So I'm just going to show you some of the kind of adjustments you might expect to see on a care chair to start with. So obviously we're talking about someone that's hoisted. So a care chair tends to have a foot plate there, and obviously, as you'd expect, you've got adjustment on that. And as Joe was saying, the most critical measurements really are your seat depth, your seat width, and your seat height, which for the seat height in this instance, we're looking at the foot plate height, because that's where the user's feet go. So we'll have a look at that first. So it's always best to try and raise up the leg rest if you're using a care chair first. And you've got, on this model, you've got a couple of pull plunges and different holes to choose from, so you can adjust that height there. So if we were looking at actually measuring this for someone to sit them in the chair, we'd put the footrest down, so we'd have it up for adjusting the length and down for measuring it, and we measure from the middle of the foot plate to the top of the seat cushion here. And it's important to note that on some chairs your cushion might not be completely flat. There might be a raised section at the front and more of a well at the back. So take that into account when you are measuring. Now, seat depth, we're going to the back of the cushion here and to the front of the cushion here, and the way we adjust that on this care chair is you've got a little pull pin here, which you just remove, and then you've got a handle here, and you can very quickly lengthen and shorten the seat depth. Now, if I just move this round here, you can see the whole leg rest and the whole seat is moving in and out so that we've got different seat depths here. So this is very easy to adjust. You don't need any tools. You don't need to get your toolkit out, and you can literally just pull a pin out and move it and adjust. So this type of chair where you do have those adjustments, it just makes it a lot easier, because yes, you take measurements during an assessment, but when the chair arrives, you can then fine tune it, tweak it, try different positions if you need to. And I think the other thing is that if you do have a chair that's adjustable in seat size, it means it can be used for different patients. So you can reconfigure it, reissue it from stores, or if you're in a multi-user environment like a hospital, you can very much adjust it to suit different patients that might be sitting in it. So it's important to look for something that's adjustable like this. Seat width. So on this chair, we've got two little screw knobs, one each side under the chair, and that's it. You just slacken those off with your fingers, and then your arms slide in and out over the seat. So you can adjust the seat width to suit that individual user. But once you slacken those off as well, you can take the full arm out, so great for side transfers and cleaning, applying a lifting sling. But once you've taken the arm out like that, we've got a couple of pull plunges. I'll pop it up here so you can see a couple of pull plunges. So you just pull those out, and you can move this bracket up and down. And that changes, if I put the arm back in, that changes the arm height. So not every chair has arm height adjustment, but the Lento range does. And we heard from Joe about how important that is. So arm height has a big impact. A lot of people don't really think about it, but we all know how uncomfortable it is to have arm height that's too high. So we're pushing shoulders up, and that can tend to encourage leaning, because people like arm support, so they might just have one side and end up being pushed over. Same if the arm height's too low, we're looking for that support, so we lean to one side to try and get that support. And then there's other things as well, like if you've got someone who's mobilising, who's still standing for transfers, they want to be able to push down on the armrests. And if they're too low, or if the seat's too wide, then we've got an issue with pushing down to stand. So arm height is important. And the way we generally measure arm height, as Joe said, is from the middle of the seat cushion. So when I say the middle, I mean we look at the seat depth here, and we choose the middle of that seat depth and go from the seat cushion to the top of the arm there. One point to note is that different manufacturers do look at seat sizing a bit differently to each other. So some people talk about measurements with compressed seat height, so as if someone's sat on the chair and you're pushing the cushion down, and others talk about it with uncompressed seat height. There's pros and cons for both ways. We tend to use uncompressed because obviously it depends on how heavy the user is as to how much the seat cushioning is going to compress by. I hope that kind of makes sense, but it's just something to be aware of. Now, when you've got an adjustable chair like the Lento range, that's not an issue. But if you are doing a made-to-measure rise and recline chair, for instance, with no adjustment that can be made after manufacture, it's important to check with them as to how that works in their world. And then obviously the other measurement is back height. So this isn't as important as the other measurement, but we still want to make sure that we've got the right back height for that individual. Not only from the point of view of getting the head support in the right place and making sure there's enough head support so they're not kind of leaning backwards like this and looking for support for that head. But also the back height has an impact on where the support is. So where's the lumbar support in their back? If they're sitting for long periods, they'll want that support. And then whereabouts is the head support? Because obviously your shoulders kind of sit a bit further back into the chair than the head does. So that's why we tend to look at kind of back height. Now, back height we measure from the middle of the seat to the top of the backrest, obviously, and try and kind of sometimes, if you are measuring a chair, it's nice to have a ruler as well as one of these tape measures or a book, and then you can put it on there and measure across up to the book or the ruler, which just makes it a lot easier than trying to kind of guess where the top of the cushion comes to. Back height on this chair, as standard, you've got your back height here, but if you do want a bit of extra head support, you can quickly switch that cushion round. I don't know whether you can see there, but that kind of brings the head height a little bit further up. And then we do a headrest which bolts onto the top that comes right over the top for a lot of head support and adjustment, etc. But if you do have a particularly tall user, that can work well for them as well. And then I mentioned the Lento Mobile, which is the rise and recline version. So as I said, it tends to be quite unusual to have a rise recliner that's quick and easy to adjust size wise. In fact, a lot of rise recliners don't have the ability to change the seat sizing. But the Lento Mobile, the reason I've just got it here is that we've got exactly the same thing as you've seen, the ease of adjustment, the speed of adjustment without any tools needed, and the range of adjustment as well. There's a massive seat depth range, and you can basically get someone from kind of early 5 foot height right up to, we've had someone of 6 foot 4. I think we've had someone of 6 foot 10 in the same chair without any additional kind of manufacturing changes, just with the maximum sizes put in and the accessory of the head support in there. So there's loads of adjustment that can be made, but the Lento Mobile is a great product for if you're needing a rise recliner, someone who's still standing, but you want that the ability to adjust it over time. So I hope that makes sense. Sorry, a little bit of a whistle stop tour there, but I just wanted to try and bring some of the things we've been talking about to life. So I'm just going to go back upstairs now and we'll move on with the Q&A section. Please do keep popping them on the chat as you think of them. Thank you.
I've had a read of the questions. Thank you for some lovely comments about the webinar. I'm always pleased when people found it useful. Nice comments are good, but to read when people have found it useful, that's what it's all about. CPD time's precious, and we need to make sure it's valuable learning that we attend. Thank you. So a few questions that I've picked up on. Hopefully everybody can hear me. One of them was about how do we measure when somebody doesn't have a seat already, so they're currently without seating and they're being cared for and living mostly in bed, apart from getting out of bed for personal care, I suspect. So that is trickier. And as I said at the beginning, try and sit somebody on a firmer support surface. We're not all working in clinic rooms. We don't all have plinths, and many of you are working in the community, and you have to do what you have to do in the client's home, which often isn't ideal. So I would say I am in this scenario myself sometimes as well. And then I would say that you need two people. You need two of you, or a reliable family member or carer to assist. If possible, and if it's a height adjustable bed, in most cases it will be, hopefully, hospital type bed. If you can get the person with another person safely into a seated position on the edge of a bed, that would be one option I would go for, because it would give me a lot of clinical ideas about how much support they need. If somebody hasn't sat for a long time, that won't be possible because they just won't be comfortable doing that. But if somebody has been discharged from hospital, they don't have home seating, but they were sitting not too long ago, I would try with a colleague bringing them safely into sitting, and looking at them, one from behind, one from in front, looking how they sit, and also taking that opportunity to take your best measurements. They won't be 100% accurate on the edge of a bed because of mattress, but you will still get a good seated measurement of from the back behind their bottom right up until the crease, to get their upper leg measurement, which is seat depth, and then their width. If you can't sit them, take the measurements in lying. So this comes up on a couple of questions. So in supine, always, this is common sense, ask for consent. I've been surprised the amount of people I see at home who are not dressed under the covers. They might have a little top on, but they have no clothing underneath. So that'll be for practicalities with toileting, etc. So I will say, is it okay? Are you wearing any garments? Is it okay if I take the quilt down? If they aren't wearing garments, I would then try and find a blanket in the room to put over them to give them a bit of dignity. And just explain, I do need to put my hands on you, and that they could feel very vulnerable if they're lying in their bed with no quilt on them, if you've not really explained what you're going to do. So in supine, I would lower the bed as much as possible so you have got them flat, not that you're compromising their breathing or swallow. And then I would do measurements across them, leaning over them, across their width, hip width. In lying, it will present a bit different than in sitting, because as we know, in bodies, in bigger bodies, in older bodies, in lying they spread, whereas in sitting it all comes together a bit more. So that will be, I would note this measurement was taken in lying. And then for leg seat depth measurement, upper leg measurement, I would, if possible, I would ask questions about hips. First of all, if there's two of you there, I would flex the hip as much as possible. I'm just doing it on myself, but you can't see it. And to answer somebody's question, yes, I would take a measurement with a bent knee, flexed knee, if that was possible too. So you've got correct loading behind them because they're lying. So you've got their back loading, and then you're taking measurement. Slide your hand gently under their bottom. That would be your back, the back point, as if you're in the back of the chair, and then measure up towards the bent knee. That will also give you a good indication of how much range there is in their hip and how much range there is in their knee. If that is not possible, if you're there on your own, I would take that measurement with their leg extended flat. And again, just note this measurement was taken in lying. So I would go as far as a side lateral view of the knee through the middle of the knee and say it was taken from there, or just state it was taken above the knee in lying. That is the best you can do. So I would take as many measurements as possible across the hips in lying, across the shoulders in lying, that'll give you an idea of their back width. Across their trunk, maybe, but again, this is very, very personal when people are lying in bed. Hopefully that answers that question. Sorry, I've rambled a lot with my answer. Okay.
That's helpful. It is a difficult.
It's a tricky one,
process,
but it's not unusual to see. It's a common thing that we will deal with in healthcare. Yeah.
Absolutely. Question from Jane here. Can you have rotation and windsweeping?
Right, interesting. So when you've got rotation, let me just think this through. So rotation is where the pelvis is rotating, and then the legs. Yes, I suppose you can. It is a sweeping from the hips. Wind sweeping is, so the hips are sweeping and the legs are falling to the same side. So you could get pelvic rotation and some wind sweeping, yes, but usually you'll see clearly it's one, or you don't see as much wind sweeping as you think. It will be called wind sweeping and it's often pelvic rotation, and just that the legs are also following the pelvis. So true wind sweeping you don't see very often, but it will be called wind sweeping on a description. And I guarantee that person that said there's wind sweeping, it's not, it's pelvic rotation. So I'm just a bit of a stickler on that sort of thing. Okay.
Good.
There was
Thank
another
you.
question about measuring for larger clients, larger people.
That's right. Maybe where they have a shelf, gluteal shelf,
Gluteal shelf, yeah.
And it can be harder to feel for their pelvis points.
It can. It's really hard to feel for the pelvis, and again, it's very personal. And if somebody is larger with a lot of tissue there, a lot of fatty tissue, whatever we want to call it, delving in there to find pelvis can be really tricky. And sometimes you'll have to do more of an eye shot of it, and you'll see that somebody's pelvis isn't level. If somebody is bariatric, I don't try and feel their pelvis. I must admit, I just go off eye gauge, an eye judgment on it. So with the gluteal shelf, you have to allow space for that. In a wheelchair, it's maybe a bit easier because you can have the tension adjustable straps really loosened at the back to give enough space for that gluteal shelf. And I suppose that would be similar with some of your seat back cushion options, would it?
Yeah, so for often for bariatric clients with a gluteal shelf, you'd use a waterfall back, but with the bottom cushion reduced, or you can take wadding out, or you can actually specify a different size bottom cushion, just so you've got room for that. And then kind of interesting one as well is that often with bariatric patients, you've obviously got a lot of edema in the lower legs and thighs. So you might find that your seat height is nowhere near what you expect it to be against the size of against the height of the person, because it's been reduced. And then your seat depth, yes, you need more space if there's a gluteal shelf, but again, there might be a lot of flesh on the back of the legs, so that kind of reduces the depth a little bit as well. So it can be quite tricky with a bariatric patient. But again, if you've got something that's adjustable, it does make a big difference.
Future proof. I think we're in an age now with all these new medications, weight loss medications, etc. I have seen people that they've dramatically changed in size over like a 3-month period. So knowing that you've got seating that's future proofed, adaptable for that change. Otherwise, if you've gone for sometimes like something that was in store that wasn't as adjustable, you haven't saved anything really, because you're having to do a whole new assessment again to give them a whole new seat. So if you know somebody's bariatric on this weight loss journey, I would go for something there. It's going to need to be reviewed and changed.
I think that's a really important point, Joe. And our bariatric chairs. So we've got we've got 3 kind of bariatric chairs in the range. One is a bariatric care chair, and then the other 2, there's a mediatric 40 stone weight limit rise and recline chair. And a bariatric 50 stone weight limit rise and recline chair, but all of them are adjustable in size, including seat width. And
Brilliant.
even if a bariatric client isn't on medication, you do tend to find that their weight fluctuates more than a normal person. They might put weight on or lose weight quite relatively quickly. So having that ability to adjust is important. And just while we're on that kind of subject, if you've got someone with a condition, sadly, like Huntington's, where you're moving a lot, you tend to find that over time they'll lose weight, and you'll need to bring the seat width in, because if they're moving a lot, you don't want too much kind of, for want of a better expression, space for them to rattle around in and cause themselves damage, cause themselves harm. So again, with a chair for Huntington's or that kind of condition, make sure you've got your seat width adjustment in the chair. Otherwise, you'll be ending up specifying a new chair in a few months' time. I think.
What's often, just one thing on that, what often isn't factored into this equipment selection sometimes is the cost of clinical time. So if you have to keep going out because you didn't get the right chair at the start, and this will go for wheelchair, home chair, any chair, the clinical time soon adds up when you're having to just keep, because you took a shortcut in the beginning. You will actually, what you may have saved on equipment, you will more than spend on clinical time, believe me. So just that was a side thought that came in there.
Absolutely, yeah. The clinical time is it's a constraint, particularly in the NHS. So yeah, absolutely key. I noticed there was a question on there as to the widest seat width on the Lento range of chairs. I don't know whether this is referring to bariatric or not, but for the bariatric rise and recline chair, the maximum seat width on that is 30 inches as standard. So it goes from 24 to 30 inches, but we've made much wider. But there is a lot of seat width and seat depth and seat height range in all of the Lento chairs. So if you are interested, have a look on the website, and there's measurements in the specifications tab there from and to. So I think we do have more questions on the chat. Unfortunately, we're already over time, so we're probably going to have to wrap up now. Thanks so much for your engagement, though, really appreciated. If you do have, well, we had a little plug from Joe earlier on it, but we do have a lot of free resources on the website, on the www.vivid.care. There's ebooks, and I'll send you a link to one of the ebooks which has got the form in that Joe referred to earlier, the assessment form. But there's all sorts of other kind of justification templates to help you with writing justifications. There's prescription forms, there's training videos, there's past webinars. So please do have a look and check it out. And as I said earlier, please do give us a call or send us an email if you've got anyone that you're struggling to see, or you're wanting to look at specialist chairs for your facility. Please do give us a shout, and we'd certainly be glad to show you the range and let you get hands on with it and see how easy it is to adjust for yourself. Thanks so much, everyone, for taking the time today to invest in yourself and to join us here along with Joe for the CPD webinar session. Very much enjoyed having you, and thanks for all the engagement. Thank you.
Thank you, everyone.